Jenny is a 16-year-old female visiting the eating disorder clinic for the very first time. She was referred to the clinic by the physicians in the ER after fainting during gymnastics class, where she suffered several bruises and a laceration on her forehead. Jenny has a difficult family history. Jenny's father drinks a lot and often, and he also abuses Jenny's mother physically. Jenny is the middle child between two boys and is oftentimes left out by her father. In the past year, the patient decided to lose weight. She is physically active with school, volleyball, and track. In addition, she walks 45 minutes every day. In addition, the patient has experimented with Lasix and is currently using Metabospeed XXX, which is a diet pill used to curb appetite. She denies any forced vomiting or use of laxatives, and the patient has no allergies to drugs or any medications. The patient's mother has grown concerned because Jenny has not been herself lately. She is touchy and argumentative. Jenny admits to feeling tired, sad, and worried, and she also feels neglected at times. Jenny has no psychiatric history or any major medical issues, except for she has a history of UTIs, and the patient suffered an episode of anemia last year and has the occasional headache. Overall, Jenny says she's okay but appears extremely thin. She is trying to lose weight because she is unhappy with her body image and wants to be more attractive. The patient complains of feeling weak and fatigued and is always cold. In addition, Jenny mentioned she feels her heart flutter at times. The patient normally has a bowel movement daily but has not had one in 3 days. Also, the patient's last period was 6 months ago. The patient has several abnormal vital signs. Her blood pressure is 125/80, which is a little high, and her pulse rate is 52 beats per minute, which is really low. In addition, her temperature is 95.3 degrees Fahrenheit, which is also low, and she's 5'2" and weighs 89 pounds, which is considerably underweight. The patient has normal skin tone without any rashes or lesions. However, it is cool to the touch and has decreased turgor. The patient's head, eyes, nose, ears, and throat exams have all normal findings, except the patient's hair is very thin and dry. Likewise, Jenny's neck and lymph nodes, breasts, lungs, cardiac, abdomen, genitalia, and neurologic exams appear normal. According to the musculoskeletal and extremities examination, the patient's extremities feel cool to the touch. The patient's urine analysis test was normal, but her urine was dark or amber in color. In addition, the electrocardiogram showed no abnormalities except for bradycardia. Lastly, the laboratory blood test results showed several abnormalities, including increased sodium, chloride, blood urea nitrogen, and alkaline phosphatase levels, as well as decreased potassium and total protein levels. Overall, the patient displays the signs and symptoms of anorexia nervosa.